Hello everyone. So today we are going to be discussing radioimmunoassay. It is an in vitro assay that measures the presence of an antigen with very high sensitivity. So it is carried out in a stepwise manner. We obviously need an antigen that is known to us. In this particular example, we are taking antigen A, which is obviously known to us, and then we also, as we know that for every antigen there is an antibody, so antibody is specific for a particular antigen, right? So we want an antigen that is known to us. Now the other thing that we need for this particular test is obviously the patient's sample. In this example, we are calling it antigen X because we do not know what this antigen, whether this antigen is the same antigen that we are looking for. Now the first step in this process of immunoassay is to basically prepare the antigen. The first step is to label the known antigen A in this particular case, with a radioactive element. For example, we are using iodine 125 in this particular example. So once it is labeled, it is easy for us to detect it using different instruments, right? So then obviously this radio-labeled antigen is now introduced into an antibodies. These antibodies again are known to us, so obviously this antigen will bind to these antibodies. So this is the first step. Now in the step 2, what we will do is we will introduce the patient's serum into this prepared slide containing a known antigen labeled with iodine and an antibody. Now if this antigen X is the same antigen as antigen A, it will compete for the antibodies with antigen A, right? So if the concentration of the antigen that we are introducing into this sample is more than the antigen A, then obviously it will displace it from the antibody, and as a result this will bind to the antibody. Now in this example we can see that 2 antibodies are bound to the radio-labeled antigen and 2 are bound to the patient's antigen X, right? The next step is called a washing or washout. In this particular case, what we do is we get rid of the free antigens that were previously displaced by the antigen X, right? As a result, what happens is that we will get a sample that contains antibodies, some of which are bound to the antigen A, some of them are bound to antigen X, right? Now we will use an instrument to basically detect the radioactivity from this particular sample, and what happens is that because the radio-labeled antigen has been dissociated from the antibodies, so the radioactivity should change. So the initial radioactivity that was measured should be more than the radioactivity that is measured from the sample now. So this means that there has been a change in the radioactivity. So we can confidently say that this patient has got the same antigens that we were testing it against, because we had known the antigen A. Now we know that the antigen X is for sure an antigen A, and this is how we basically look for antigens. For example, if we are suspecting a particular patient to be suffering from a particular viral infection, then we order this particular test, so it will just confirm as to whether this patient is having the antigen for that particular infection or not. I hope this makes things clear. Please don't forget to subscribe to the channel for more such videos. Thank you.